Advancements in healthcare have come in recent years thanks to breakthroughs in technology that allows doctors to see more of a patient and possible problem areas. Tonight in our cover story, News 4's Margie Reedy shows us one of the most powerful new research tools that's available to medical science, and it's right here in Detroit.
It's one of two in the world, a 40-ton magnet with power 40,000 times the Earth's magnetic field. The Nuclear Magnetic Resonance Spectrometer, or NMR, allows doctors to look inside the body, take clear pictures, and judge chemical makeup. The picture is created by putting a patient in the magnetic field and bombarding them with harmless radio waves. This information is fed into a computer which reads the signals and develops a picture.
And what you see down here are the eyeballs, the ears, just to orient you. Here's the brain and the nose.
From this, doctors can see immediately if there's any physical damage inside a patient's head. They can also use the NMR to chart chemicals in the brain. Each peak on this graph represents a different chemical. Too much or too little of some chemical can indicate a certain disease. By giving doctors a clear picture of the brain, the NMR can tell doctors just how much damage is done by heart attacks, strokes, and tumors. In the future, it may even be able to tell them if prescribed drugs are effective. For the first time, doctors could actually watch chemotherapy work on a tumor.
And of course, when you're dealing with brain tumors, which can be, in a few rare cases, very malignant, you don't have the real time to wait 3 to 6 months.
Dr. Fraser Keith is using the NMR to research transplant rejection, important since all transplanted organs go through some type of rejection.
I'd like to be able to catch this early and be able to treat it and reverse it before any real damage has been done to the transplanted heart.
Doctors in emergency medicine are using the machine to study heart attacks. Right now, the typical way of restarting someone's heart is with CPR, but some doctors think that may get the blood flowing too slowly.
There are a significant amount of people that don't get up and walk out of the hospital and are left with some degree of neurologic impairment.
Dr. Martin says if blood is reinfused quickly, a person's heart may be able to be stopped for a longer time with less damage. In this experiment, they stop a dog's heart for 12 minutes, much longer than is allowed for CPR. They restart the heart and supercharge the blood with oxygen, pumping it in quickly. So far, the results of their tests are good. The dog seems to recover all normal functions. They'll soon use the NMR to see exactly how the brain is affected by this new method. In most major hospitals, imaging could one day become a regular part of diagnosis. An imaging machine will soon be used for patients at Henry Ford Hospital. 8 to 11 of them will be